This module is about safe sleep practices for your baby. The ABCs of safe sleep. A is for alone. That is, your baby should always sleep on their own sleep surface. It's not encouraged to bed share with the baby as it is a risk factor for sudden unexplained infant death syndrome, commonly known as SIDS. B refers to back. The baby should always be on their back when they sleep. C refers to crib. The crib should always be empty. No blankets, pillows, stuffed animals, toys, or supplies like diapers or diaper wipes should be inside the crib. While making a place safe for your baby to sleep, please note that it's okay to room share. That is, you can share a room with your baby, but please do not share a bed. The baby should not share a bed with other children or sleep in a bed with toys or pets. Always put your baby to sleep in a separate but close by safe place to sleep. Let's look at this picture. The picture depicts the standard way of putting a baby to sleep. The arrows point to parts in the picture that show each additional step for making a place safe for your baby to sleep. On the left, the first item refers to using a firm sleep surface such as a mattress. The next two steps refer to making the mattress free of pillows and blankets as indicated. Ensure a smoke-free environment by not letting anyone around your baby smoke. If anyone has to smoke, they should do it outside the house. Now follow along on the right. Make sure that nothing covers the baby's head. Always place your baby on their back for naps and at night. Dress your baby in sleep clothing such as a one-piece sleeper and do not use a blanket. The sleeping area should be next to where you sleep. And lastly, the baby should not sleep on an adult bed. The baby should be in their own crib nearby to you. Next, we'll move on to making a safe lying breastfeeding position. Breastfeeding has been shown to reduce the risk of sudden infant death syndrome, or SIDS. It's okay to breastfeed your baby in the bed with you, but always remember to put them back in their own crib when you are done breastfeeding. And if it happens that you fall asleep while breastfeeding, put the baby back in their own crib as soon as you wake up. We have learned about making a safe place for your baby to sleep and making a safe breastfeeding position for your baby. Now we'll talk about making a safe home environment. When people in your home need to smoke, kindly encourage them to smoke outside and wear a fresh layer of smoke-free clothing when they hold your baby. Offer a clean pacifier to your baby at sleep times, but do not force your baby to use a pacifier. When your baby is using a pacifier and it falls out of their mouth, you do not need to put it back in the baby's mouth. And when it's time to sleep, babies need one or more extra layer of clothing than adults. Lastly, when the baby is asleep, ensure that the sleeping rooms are set at a comfortable temperature. Thank you for listening.